Today, we're going to talk about schizophrenia, what it really is, how it affects a person's life, what causes it, what treatments are available, and most importantly, whether recovery is possible. Before we begin, I'd like to mention that this video is meant for educational purposes only. If you or someone you know may be experiencing symptoms of schizophrenia, please consult a qualified psychiatrist for proper evaluation and treatment. So let's begin. What is schizophrenia? Schizophrenia is a serious mental illness that affects the way a person thinks, perceives reality, feels, and behaves. Because of changes in how the brain processes information, a person with schizophrenia may find it difficult to distinguish what is real from what is not. Worldwide, about 1 in every 100 people develop schizophrenia during their lifetime. It most commonly begins between 15 and 35 years of age, although it can occur at any age, even in children. What are the symptoms? The symptoms are usually divided into 3 groups: positive symptoms, negative symptoms, cognitive symptoms. Let's understand each one. Positive symptoms. The word positive doesn't mean good. It means something extra has been added to the person's normal experience. These include delusions, hallucinations, and disorganized thinking. Delusions. Delusions are strongly held false beliefs that are not based on reality and are not shared by people from the same cultural background. For example, someone may firmly believe that people are spying on them, trying to poison them, or controlling their thoughts. Even when there is clear evidence against these beliefs, the person continues to believe them because to them, these experiences feel completely real. Hallucinations. Hallucinations are perceptions without an external stimulus. The most common type is hearing voices when no one is actually speaking. These voices may comment on the person's actions, criticize them, talk about them, or even give commands. Some people may also see things that others cannot see. Disorganized thinking. Many people with schizophrenia experience confused or disorganized thinking. Their speech may become difficult to follow because their thoughts jump from one topic to another without a clear connection. Some people also experience what are called passivity experiences, where they feel that an outside force is controlling their thoughts, emotions, or actions. As you can imagine, these symptoms can be extremely frightening and distressing. Negative symptoms. Negative symptoms refer to a reduction in a person's usual abilities or functioning. For example, the person may speak very little, withdraw from family and friends, lose motivation, stop enjoying activities they once loved. Sometimes these symptoms become so severe that the person stops taking care of themselves. They may avoid bathing, brushing their teeth, changing clothes, or grooming. Their facial expressions may become limited, making them appear emotionally flat. Unfortunately, these symptoms are often mistaken for laziness. That is not true. They are part of the illness itself. Cognitive symptoms. The third group is cognitive symptoms. These include problems with attention, concentration, memory, planning, decision-making. Simple everyday tasks like following instructions, managing finances, or organizing the day's activities can become very challenging. What causes schizophrenia? There isn't a single cause. Schizophrenia develops because of a combination of genetic, biological, and environmental factors. Having a close family member with schizophrenia increases the risk, but it does not mean the illness is inevitable. Differences in brain development and how certain brain chemicals function also play an important role. Environmental factors such as complications during pregnancy or birth, severe childhood adversity, certain infections affecting brain development, and heavy cannabis use during adolescence, especially in people who are genetically vulnerable, may increase the risk. One thing is very important to remember: schizophrenia is nobody's fault. Neither the person nor their family caused the illness. Can schizophrenia be treated? The answer is yes. Treatment usually includes medicines called antipsychotics. These medicines are very effective in reducing hallucinations, delusions, and disturbed thinking. Some people experience improvement in negative and cognitive symptoms as well. although these symptoms can sometimes persist and require additional rehabilitation and psychosocial interventions. One important point many families don't know is that these medicines do not work overnight. Unlike medicines for fever or pain, antipsychotic medicines usually take 2 to 3 weeks, and sometimes even longer, before significant improvement becomes noticeable. So patience is extremely important. Depending on the person's illness, treatment may continue for months, or in many cases for several years. Some people may require long-term treatment to prevent relapse. As symptoms improve, many patients become well enough to return to their studies, work, and daily life. Why should medicines not be stopped suddenly? A very common mistake happens after the person starts feeling better. Family members or friends may say, "You're completely fine now. Why continue these medicines?" The medicines are then stopped without medical advice. Unfortunately, this greatly increases the risk of the illness returning. If someone wants to know whether medicines can be reduced or stopped, the correct approach is not to stop them on your own, but to discuss it with the treating psychiatrist. Treatment is always individualized. The duration varies from person to person depending on their illness and response to treatment. Does everyone recover in the same way? Unfortunately, no. Recovery varies between individuals. Some people recover very well after treatment and may never experience another episode. Many recover well, but may have occasional relapses, especially if medicines are stopped prematurely or during periods of significant stress. Others continue to have ongoing symptoms and may require long-term treatment and rehabilitation. The important message is this: recovery is possible, and many people with schizophrenia lead meaningful and productive lives. How can family members help? Family support plays an enormous role in recovery. Families who understand the illness, provide emotional support, avoid unnecessary criticism, and encourage treatment greatly improve the person's chances of recovery. Helping the person return to education, work, social relationships, and meaningful daily activities is equally important. Why is early treatment important? Treatment works best when it begins early. If someone has become increasingly withdrawn, is hearing voices, talking, or laughing to themselves when no one is around, expressing unusual beliefs, neglecting personal hygiene, or behaving very differently from before, encourage them to seek help from a mental health professional as early as possible. Early treatment is associated with better long-term outcomes. Let's clear up some common myths. Myth: people with schizophrenia have multiple personalities. Fact: this is false. Schizophrenia is completely different from dissociative identity disorder, which is a separate and much rarer condition. Myth: all people with schizophrenia are violent. Fact: this is also false. The vast majority of people living with schizophrenia are not violent. In fact, they are far more likely to experience stigma, discrimination, and even become victims themselves than to harm others. However, it cannot be denied that some patients with schizophrenia can become verbally and physically aggressive when symptomatic. If someone you know has schizophrenia, please remember these simple points. Don't argue with their hallucinations or delusions. Stay calm and listen respectfully. Acknowledge that they are experiencing real distress. Encourage them to seek professional help. Continue treating them with dignity, patience, and respect. Sometimes compassion is just as important as medicine. Final message: schizophrenia is a medical illness, not a personal weakness or a character flaw. With timely treatment, family support, and continued care, many people living with schizophrenia can recover and lead fulfilling lives. If you found this video helpful, please share it with your family and friends. Take care, and remember, mental illnesses are real, they are treatable, and recovery is possible.